What does 1,490 visits actually mean? In rural Tanzania, access to healthcare is not a given. For many individuals living with disability, distance, cost, stigma, and lack of information create barriers that prevent any engagement with formal medical services. Without intervention, conditions go untreated, complications escalate, and entire households carry the burden. This is why our Outreach Healthcare project exists. In the first quarter of this year, this is what our impact looked like. 429 individuals living with disabilities are now registered in our program across the area we serve. An average of 264 people was reached per month in their homes by our team, delivering consistent, unpersonalized care. Some people receive frequent visits, others only when needed, depending on their individual needs. In total, that was 1,490 home visits that was conducted just in the last quarter alone. And that is an average of 24 visits per day across our 3 teams. But all these numbers only tell part of the story. A while ago, our team were alerted to a man who had experienced multiple strokes. Without access to formal health care, he had initially sought treatment through a traditional healer. The underlying cause, high blood pressure, remained undiagnosed and untreated. After a second stroke, he was left bedbound with significant loss of mobility. By the time our team reached him, his condition has progressed severely. Today, we have changed that trajectory. Through consistent support by our outreach team, his blood pressure is now stabilized with medical treatment. He is receiving ongoing physiotherapy and occupational therapy to rebuild strength and coordination. With a wheelchair provided by our team, he is no longer confined to his bed, and he can sit up, he can move outside, and he can re-engage with daily life supported by his family. This is what is possible when we provide access to continuous community-based healthcare. During another visit, also to a stroke patient, another story emerged. In the background of the household was a little girl. I found she was mute. She had never been assessed by a medical professional. And although we still don't know the reason why she's mute, we are now investigating why she's not speaking. Without this visit, it is unlikely she would ever have entered any form of care. She's now registered in our program. Our team is working with her family to better understand her needs and ensure she receives appropriate support moving forward. This is a critical part of outreach that is often unseen. Each visit does not only deliver care, but also identifies individuals who would otherwise remain completely outside the healthcare system. These are not the only cases. For many of the individuals we reach, it is their first contact with any form of medical care. Our outreach model creates a continuous pathway. We identify individuals in their homes. We provide immediate care and assessment. We connect them to services at Kamanga Health Center, our hospital, and we deliver ongoing follow-up through regular visits. This work takes place across a geographically large area, covering 2 wards in rural Tanzania, home to tens of thousands of residents. Roads are limited. There are no paved roads, only a small number of main dirt roads, and many areas are accessible only by narrow tracks that cannot be reached by car. To navigate this, our teams operate in pairs, using off-road motorbikes. This is often the only way to reach the most remote households. All team members undergo driving lessons and safe riding training with annual refreshers to ensure both safety and reliability in the field. Alongside this, our team continues to build local capacity. Weekly occupational therapy clinics are running at Kamanga Health Center, and team members are undertaking further medical and counseling training to strengthen long-term service delivery. This is how sustainable community-led healthcare systems are built. We are now working towards registering and supporting 500 individuals across our areas, ensuring that those currently beyond the reach of our healthcare system are not left behind. Because access to healthcare should not depend on where you live, your mobility, or your circumstances. It should be consistent, reliable, and within reach. And that is exactly what outreach is designed to deliver.